So we're going to have two presenters now. We are particularly honoured to welcome Katharina Wunderlich, who oversees the NoboCap project at the European Commission. We're particularly honoured to welcome her to give an overview of the changing regulatory environment for medical devices, IVDs, digital AI, and combination products. The Commission is in a state of flux at the moment, with a new Commissioner designate named responsible for health. So we're fortunate that the Commission can speak to us, given the constraints that can be imposed on staff during these periods of change. So I'd like to welcome Katharina. Please present your slides.
Thank you very much. Good morning. Yes, my name is Katharina Wunderlich. I'm a seconded national expert at the Commission in the Medical Devices Unit, and I will be replacing my head of unit, Flora Georgiou, who's unfortunately in an important meeting at political level, so cannot join us today. I will try to give you an overview about, and I have some slides also, if you can put those on the green. Yeah. So yeah, I will try to give you a brief overview of three regulations that are also affecting medical devices. The first one is the regulation on health technology assessment. This was adopted already in December 2021. The transition period ends actually mid-January 2025. And the regulation sets up a mechanism for the submission of evidence for joint clinical assessments at EU level. It provides common rules and methodologies for joint clinical assessment, basically trying to have one assessment at EU level instead of 27 assessments in all the member states. So the aim is to improve patient access to innovative technologies, to improve the quality of HTA, of health technology assessments across the EU, and to avoid duplication, to ensure efficiency also in the collection of clinical evidence. And the joint work at EU level is limited to clinical aspects of HTA. So on the one hand, we have joint clinical assessments, which are assessments of the relative effectiveness and relative safety of a product in comparison to what is already on the market. And then we have joint scientific consultations, which is advice to manufacturers on their plan to generate clinical data in view of a future joint clinical assessment. So HTA bodies of the member states are cooperating at EU level. And what is important is that member states remain responsible for drawing their own conclusions on the added value of the joint clinical assessment for their health system. And they, of course, take decisions for pricing and reimbursement, hopefully taking into account the joint clinical assessment at EU level. And the regulation foresees a staggered approach. So from January of next year, the focus will be on cancer medicines and ATMPs for the first 3 years, and then from January 2028, it will also include orphan medicines, and from January 2030, the full scope of the regulation will apply. And within the scope is also a selection of high-risk medical devices with expert panel opinions or views. So the scope of the joint clinical assessment includes Class 3 and 2B medical devices and Class D IVDs. And these have to have an expert panel opinion or view, according to MDR and IVDR, and they also have to be subject to selection criteria, which is set out in the HTA regulation, Article 7, Paragraph 4. So these are, for example, unmet medical need. The devices have to have a potential impact on patients, public health or healthcare systems, and maybe interesting for this audience, They can also incorporate a software using AI or machine learning technology or algorithms, or the devices have a cross-border dimension or a major union-wide added value. And for the scope of the joint scientific consultations, basically, it's also medical devices and IVDs that are likely to be subject for joint clinical assessment and where the clinical investigation has started and is being planned. And the Commission will adopt the implementing acts that are relevant for these procedures by January of next year, and the joint clinical assessments will start only in 2026, and the joint scientific consultations already in the second half of 2025. So this is something to be aware of. The next regulation is the Artificial Intelligence Act, which just came into force actually on the 2nd of August of this year. It foresees a 2-year transition period, and for medical devices, it's 3 years. And the AI Act sets out a horizontal EU legislation laying down uniform rules for artificial intelligence in the EU. It's basically internal market product safety rules, and they cover a broad variety of sectors. Health is just one of them. And the Artificial Intelligence Act is basically innovation friendly. It follows a risk-based approach. So basically AI systems that have an unacceptable risk, for example, social scoring by public authorities or harmful manipulation technologies, they are prohibited. Then high-risk AI systems are permitted, but subject to compliance with AI requirements, and they also have to pass an ex-ante conformity assessment. This is also where the medical devices fall into this category. Then you have transparency risk systems. They are permitted, but subject to information and transparency obligations. For example, you have the chatbots or deepfakes that fall into this category. And then for minimal or no risk AI systems, they are permitted with no restrictions, and there can be a voluntary code of conduct. So for the medical devices or AI-enabled medical devices, they have to comply with both MDR, IVDR, and the AI Act. And there are, of course, some overlapping requirements like the risk management, technical documentation, conformity assessment procedures, and post-market monitoring. The Commission is looking very carefully at these regulatory or at these requirements, and we're also working closely with DG Connect, which is in the lead of this regulation, to try to use the MDR, IVDR regulatory system and incorporate the requirements into the system to avoid duplication. The AI board set up, they met on the 10th of September of this month, and they set out a governance structure, and one subgroup, which is a temporary subgroup, will work on the interplay between MDR, IVDR, and the AI Act, and they will work together with the MDCG New Technologies working group in developing a question and answer document on this interplay that is supposed to be finalized by mid-2025. So this is a very big priority for the Commission and for the MDCG. And one aspect that can be clarified maybe in this Q&A or also in another guidance document of the MDCG is the designation process for notified bodies to assess AI-enabled medical devices. And the idea is to make use of the existing codes that are set out in the implementing regulation 2017-2185, and to indicate in a column conditions whether the AI Act also is covered by this notified body or not. And the work on this question has also started. The Commission is working together with the designating authorities of the member states. And a final aspect of the AI Act is maybe the regulatory sandboxes that are mentioned in Article 57 to 59 of the AI Act. They are supposed to provide a controlled environment to foster innovation and facilitate development, training, testing, and validation of innovative AI systems for a limited time before placing on the market or putting them into use. These sandboxes should be operated by the national competent authorities. And there's also a subgroup, a standing subgroup of the AI board that will work on this topic. And they will develop an implementing act that is also foreseen in Article 58 of the AI Act to avoid fragmentation across the EU, to develop procedures for application and selection criteria, who can participate in these regulatory sandboxes. And this implementing act should be finalized next year as well. So very ambitious. And the last regulation I want to briefly mention is the European Health Data Space. There was an agreement between Parliament and Council already in March of this year, and the regulation is now with the lawyer linguists and the translation services, and it should be published and come into force at the end of this year, possibly beginning of next year. It foresees a 4-year transition period, and basically what is it about? It has three aspects. First, the primary use of health data. So the example that is given is a patient that travels or is on vacation, has an accident, that when he goes to the doctor in another country, that he can access his health data, and that also the doctor or the healthcare professionals that treat him, that they are able to access this data and avoid also costly new procedures, and this is the idea. Secondary use of health data means for research and public interest purposes, and in this sector, the data from clinical trials and studies of MDR and of medical devices and IVDs would also be incorporated. So that's the second part. And the third part are requirements for electronic health record systems. Basically, with the EHDS, you will create a single market for these systems, and they support both the primary and the secondary use of data. And for medical devices, the last part, the electronic health record systems, are important because they might have additional functions that make them also a medical device or an IVD, and then those products have to comply with MDR, IVDR, and the EHDS. And there will be an implementing act that sets out common specifications for these electronic health record systems. Yes, from the Commission. So that's it. Thank you very much for your attention.